I'm Dr. Adriana Potter. On Don't Let Pain Drive You Insane series today, we're going to talk about use of TENS unit, okay? On the link, there will be a link on the comments about the unit that I recommend for my patients, and I'm going to go over about what does a TENS do first, okay? On the previous video, when I discussed about the thermal sensation and how your body, why do topicals or any thermal sensation help with the pain, is because of that gate control that happens into your spinal cord, right? So when you're having a pain, that it means your nociceptors, which means your receptors in your body that detects pain, are stimulated because it's a painful stimulus, and your brain is immediately paying attention to that. When you add a new input, those nociceptors are not being activated as much. Now you have your thermal or your non-painful stimulus being a little bit stronger, or at least the most recent and more intense input happening in your periphery, in your skins in general. And that is actually being sent to your brain, and your brain just like, hey, that's the locus of attention. Remember we talked about that? Your brain now is paying attention to the most recent, strongest, non-painful stimulus. And then it's paying attention to that. Now you're paying attention to the tingling sensation versus paying attention to the pain, which means the gate to the nociceptors have been closed. Now you having that tingling sensation traveling in the same pathway, and which is sent to the brain and shuts the pain down to your brain, okay? When you're using a TENS unit, let's go over that. Never apply on the open skin, okay? Your skin has to be intact, and it has to have normal sensation. If you have impaired sensation, you won't feel the input happening in the area, and then the benefits will be limited, okay? Make sure the pads are sticking well, and the cables are intact. They are not, no breakage on any of the cables or any of the connections of your pads. Nice fresh battery, okay? On this unit particularly, which is the TENS 7000, I actually tell my patients to go into mode. Actually, they have to put in the skin first before you turn it on, okay? So let's say I'm gonna put into my forearm. Okay, you're gonna put surrounding the area that is painful. This unit has two channels. You can use one channel or both at the same time. Let's say I'm having pain across my elbow from a tendonitis. I'm gonna go surround the area. So I'm gonna go slightly above the area. My pain is right in here, and I'm gonna put the other pad slightly below. Make sure the skin is nice and dry. And if you have a lot of dead skin, the electrodes will eventually stop sticking to it. So make sure to nice and wipe it with a little bit of rubbing alcohol. Will remove some of the slough old skin in your body, in your electrodes will stick a little bit more easily, okay? So apply to the area, turn it on just a little bit so the numbers will show in there. And when you press the mode, it will change it into several settings, and you keep pressing until you find either burst or modulation, okay? With the burst, it kind of goes zzz and stop, zzz and stop. So it goes into short bouts of stimulation. With the modulation, it kind of goes up and down, up and down. There's not a sudden stop, it's just kind of going up and down. Those are the two you want to be using. You don't want something that goes in and it stays zzz, normal, like a continuous stimulus. And that it is the in here is called normal one. When you put the normal one, it actually it keeps the continuous stimulus. What happens is that, remember that locus of attention, we talked about it, your brain will pay attention only to the most recent and strong stimulus. If you constantly having the same stimulus, your brain will kind of stop paying attention to it. So when you apply it to the skin, you want to turn it on nice and slowly until you feel a strong buzzing sensation. Like I said, the burst of the modulation are usually the best ones, and there's a couple things you can also do. And if you have a specific question about the unit, don't hesitate to call me or text me actually on the comments, and I will address them on the comments. But you don't want to be creating a muscle contraction, okay? That could irritate the area a little bit further. Some people have done that, and I just like, no, you want to feel that sensation, but it should be comfortable. It should be painful, and it should not be creating a tetanic contraction, which is the maximum, like a cramping feeling in the muscles, okay? This unit, you can program the time, okay? So you can put it for any amount of time. There's no right or wrong how long you do it. I have personally used one time for 10 hours because I was having a major sciatica and I put that into my butt, okay? And that's the only way I actually could function and work. But I wasn't driving or doing anything that it could create a harmful situation. So you have to make sure that if you are continuously using it, you put in the timer to go on and off. So you go on and off, on and off. I mean, like you put the 60 minutes and it will go off after that and you do it again. Or you put in the continuous, which it never goes off. It will just drain the battery, okay? And that sensation, it kind of helps you with blocking that pain and not paying attention to it. The pain is still there, but usually because you have the pain, you may have the muscle guarding, which will create some stiffness, which will create more pain and then decrease mobility, decrease blood flow, which creates more muscle spasm, which create more pain. It goes in that cycle, right? So that's what we're trying to do, to break down the cycle. And when you're doing the pain management suggestions that I have in this series, is helping you to gradually break down the cycle. We're not getting rid of your pain, but we are trying to decrease the intensity and the cycle of the pain and the frequency as well. So you're gonna look for baby changes into that pain level and then gradually getting yourself out of that cycle. The cycle might be super wide and you're finally finding that you have a more narrow cycle that you're able to manage more easily or get off of that pain cycle more easily, okay? That's pretty much it for the electrical stim. Like I said, you wanna make sure that you turn it off before, make sure to dial in the right direction. If you dial in the wrong direction, what's gonna happen? Then you're gonna zap yourself. You're not gonna really hurt. It's gonna give you a big jolt, okay? And after you have turned it off, you're gonna get your pads and you're gonna put them back into the sticky part of it. And I recommend that you put inside of the zip bag that those pads come with it. It will keep them nice and moist, so it will stay sticky on it. You don't have to disconnect the cables, you can keep them connected. Use as much as you need it, okay? As long as the skin is nice and intact and don't have an irritation in the area. And hopefully that kind of addresses some of your needs for those pain management. So don't forget to put any comments or requests into your comments. Notes, and I'm Dr. Adriana Potter on Don't Let Pain Drive You Insane series. Today we cover the use of TENS unit for pain management to help you to shut the gate to the pain because your brain is paying attention to that stimulus from the electrical stim. Don't forget to subscribe, press the bell button so you can get more videos on the future for your pain management, as well your strengthening exercise, which is the Let's Get Physical, and a lot of education material on the Benefit Yourself series. Have a great day.